Coconut oil. You can use it to cook or bake, or even as a substitute for butter in some recipes. It's also been touted to help everything from heart disease to dropping those extra pounds. But it's also gotten some criticism too. Viv Williams sorts through the claims in this medical mythbuster.
Coconut oil. It's a food with a history of claims that it will help you lose weight, control blood sugar, lower your cholesterol, and even reduce inflammation. But hold on. Experts at Mayo Clinic say coconut oil will not boost your health. In fact, it may hurt it. Let's start with the public perception of coconut oil, what people think about it. The New York Times teamed up with pollsters Morning Consult for a survey that asked people how healthy they thought certain foods are.
72% of Americans polled a few years ago said coconut oil is healthy, but we found that coconut oil is 90% saturated fat. Saturated fat we know can raise our cholesterol levels.
Dr. Stephen Kopetsky, a preventive cardiologist, says high cholesterol raises your risk of heart attack and stroke. He points out that review articles in the American Heart Association's journal Circulation confirm that eating coconut oil does raise your risk of heart disease. So how then did coconut oil get the reputation of being heart healthy? Coconut oil and healthier plant-based oils like olive oil both have what's called medium-chain fatty acids. Your body uses them quickly so they don't accumulate and clog your arteries. But over time, researchers figured out that coconut oil is tricky. Review articles published by the American Heart Association explain that the medium-chain fatty acids in coconut oil act like long-chain fatty acids, the kind found in saturated animal fats, such as butter or lard. Your body can't absorb them easily, so they can accumulate in your arteries, leading to potential health problems. That's not good. So what about the other possible health benefits? Does it still regulate blood sugar and weight loss and reduce inflammation?
The studies have shown that it doesn't, that it does not help your sugar, it does not lower your weight or lower your fat, and it is not anti-inflammatory. So all these things that we had hoped would be true just aren't.
Dr. Kopetsky says you don't have to totally give up coconut oil, just don't use it as your main source of fat. What oils should you eat? Dr. Kopetsky recommends extra virgin olive oil, avocado oil, or nut oil. With this medical mythbuster, I'm Viv Williams.
I'm not sure what to think about that, but I'm thinking I do feel some relief because I thought you're supposed to use coconut oil for everything, so I'd buy big containers of it and put it in the Lazy Susan and it would just sit there.
I'm the opposite. I believe nothing.
You believe nothing?
No, because, well, remember when the fat-free movement was in and you looked at the fat-free and you read the label? It was fat-free but loaded with sugar.
Right.
Now it's gluten-free, but loaded with sugar. So I'm a label reader. I read the labels and then I research something before it ever goes into my body because I don't believe any of it. I think sell.
Yeah, well, I think the reason that people think that coconut oil is so healthy is because they see it breaking down to the medium chain triglycerides, and that breaks down to ketones. But it's not pure medium chain triglycerides, so it's only like 15%, so it's not the pure part. So it does break down, so you will get a little bit of energy. You guys know about the ketones. You will get energy from it quickly and all that, but it shouldn't be long term. Because
Energy
over
until
time,
it plugs you up
yeah,
your arteries.
over time, it really will raise your LDL.
But it is, for the sake of everything they said it's not, it is an amazing lotion and lubricant.
Is.
And especially for our aged community, natural fungal, natural antibacterial.
Yeah.
So using it for dry skin, it doesn't leave that greasy residual that a lot of lotions and stuff do. So it is amazing as a lotion, as an applicant.
And actually even for yeast and all that.
Yes. Yeah. It because it's a natural fungal. So I like if you're doing like a lymphatic massage on somebody that's got a lot of edema in their feet, the swelling in their feet and legs, use it, and it's actually really, really good. Sorry.
Yeah, and I think there's a lot of ways to cook without oil, period.
Okay.
Yeah.
Air fry.
Yeah.
Right. I love an air fryer.
I love an air fryer.
Hey, I'm just on the butter bandwagon.
Okay. I like butter. I can do that one too.
We'll be right back with more on Aging Untold.